and welcome to the Nursing and Tech Symposium as part of PSIC's Pakistan Live 2022 session. I would like to welcome you all to this session. It's a great turnout, so we're excited to have you all there. I'm Dr. Usman Fahim from Aga Khan University. I'd like to thank the PSIC Council, Dr. Nadeem Rizvi, Dr. Bashir Hanif, the organizing committees for having the foresight and the concern that, as part of a team, the team consists of nurses and technologists in the cath lab as well. And you can only progress in the cath lab to a certain level unless the team progresses with you. And as more and more cath labs open up, I think there will be more roles and more responsibility for all of you to help perform in the lab. We're excited. We have a very good afternoon session. I'd like to thank all my colleagues, Dr. Kashif Ali Hashmi, Dr. Asadullah Bukti, and Ms. Laila Hussain, who's cath lab manager, for helping put together all of this. A lot of hard work has gone into it. So without wasting too much time, I'll call Mr. Imran Mughal from Tabba, who's the moderator for the next session, and all the chairpersons and panelists for this session to please come and join him at the front, and we'll get started.
Let's start our presentation with the name of Allah, who is most beneficent and gracious. My name is Afshan Ramzan, and I am from CPEC, Multan. Today, my topic is cardiac anatomy and physiology. Start with the definition of heart. Heart is a hollow muscular organ that pumps the blood throughout the circulatory system. It's about 10 centimeters long. Its weight about 225 grams in female. It's about 350 grams in male. Its location. In thoracic cavity in the mid-sternum, space between two legs lies obliquely a little more to the left than the right, present a base above and apex below. Here we see anatomy of the heart. Pericardium. Outer covering of the heart, made up of two layers, parietal pericardium, visceral pericardium, in which space pericardial cavity filled with pericardial fluid, in which we see that outer parietal pericardium, strong protective sac for heart, anchor the heart with mid-sternum. It further divided into fibrous pericardium and serous pericardium. In outer fibrous, we see that formed of thick fibrous tissues protect the heart from overstretching. Inner serous, in which we see that it prevents the fluid friction and allows free movement of heart within the pericardium. Next, here will be the heart valve. 3 layers of tissues, epicardium, serous membrane, smooth outer surface of heart. Myocardium. Myocardium middle layer composed of cardiac muscle cells and responsibility for heart contracting, in which we see that it forms contractile unit of heart, which form pacemaker and which form conductive system. Here we see endocardium, smooth inner surface of heart chambers. In short, smooth flow of blood through the heart. Next, here is the beautiful picture of heart. This is the view of anterior view, in which we see that at right side, it will be the superior vena cava and inferior vena cava, right atrium, right ventricle, coronary sulcus, right coronary artery, pulmonary artery, and branches of right pulmonary artery. On left side, we see that aortic arch, left pulmonary artery, pulmonary trunk, left atrium, left ventricle. Next, here is the heart chambers. There are 4 heart chambers, 2 atrium and 2 ventricle, in which we see that on right side it will be the deoxygenated blood, on left side it will be the oxygenated blood. Here we see that there will be the 4 valves of heart. On right side, it will be the tricuspid valve and pulmonary valve. On right side, on left side, it will be the mitral valve and aortic valve. Next. Here we see that coronary circulation. Basically, coronary circulations of the arteries depend on two arteries, right coronary artery and left coronary artery. Right coronary artery. Right coronary artery exists aorta just superior to the point where aorta exists. Heart lies in the coronary sulcus. Smaller than the left, extend to the posterior accept of heart. It further divides into the right marginal artery and posterior interventricular artery. Posterior interventricular artery lies in the posterior interventricular sulcus, supplies the posterior and inferior accepts of heart. Left coronary artery exists aorta near right coronary branches. It further divides into interior interventricular artery, left marginal artery, circumflex artery. Left marginal artery supplies lateral wall of left ventricle. Coronary circulation, veins, great cardiac vein and coronary sinus. Great cardiac vein and small cardiac vein drain right margin of heart. Coronary sinus, veins empty here, then into the right atrium. Here is the route of blood flow through heart. In this diagram, we see that superior vena cava and inferior vena cava take deoxygenated blood from whole body, and deoxygenated blood come into the right atrium, where it crosses the tricuspid valve and come into the right ventricle, where it crosses the pulmonary valves and come into the pulmonary trunk. With the help of pulmonary arteries, deoxygenated blood come into the lung tissues, where deoxygenated blood convert into the oxygenated blood, and with the help of pulmonary veins, it come into the left atrium, where it crosses the bicuspid valve and come into the left ventricle, where it crosses the aortic semilunar valves and come into the aorta. With the help of aorta, oxygenated blood supplied to the whole body. Next will be the conducting system. Here is the SA node, which will be also known as the first pacemaker of the heart. It transfers its impulses into the AV node, where it further divided into the AV bundle, which will further divided into the right and left bundle branches. Action potential are carried by the Purkinje's fibers. These are help in the contraction of the atrium and ventricles. Cardiac cycle. Here heart is two pumps that work together, right and left half. Here we see that contraction systole and election diastole of heart chambers. Cardiac cycle. Basically, cardiac cycle contains three stages. First will be the atrial systole, second will be the ventricular systole, and third will be the ventricular diastole. The duration, it will take about 0.8 seconds. In atrial systole, active ventricular filling will be take place, in which semilunar valves will be closed, AV valves will be opened. In ventricular systole, seminal valves will be opened, AV valve will be closed to prevent the backflow of blood. And in ventricular diastole, seminal valves closed and AV valves will be opened, and in which passive ventricular filling will be happened. This duration will be take 0.8 seconds. There will be the heart sounds, which we will hear with the help of stethoscope, which will be the lub and dub. It is also known as S1 and S2. First heart sound lub occurs when anterior ventricular valves close. Second heart sound dub occurs when semilunar valves close. Regulation of heart. Intrinsic regulation and extrinsic regulation. In intrinsic regulation, we see that preload and afterload. In preload is the amount of stretch of ventricular walls. The greater the stretch, the greater the force of contraction. Afterload. pressure the contracting ventricles must produce to overcome the pressure in the aorta and move blood into the aorta. Heart note has sensitive to this as it is to change in preload. Here is the extensing regulation, in which we see that it involves neural and hormonal control, which further into parasympathetic stimulation and sympathetic stimulation. In parasympathetic stimulation supplied by the vagus nerve decrease the heart rate. In sympathetic stimulation, it will be increase the heart rate, epinephrine and non-epinephrine released. Here is the 5 amazing facts about heart. The first heart cells start to beat as early as 4 weeks. Every day, your heart beats 1 lakh times. Your heart is not bigger than the size of your fist. Each minute, your heart pumps 5 liters of blood. Happiness helps to lower the risk of heart disease. Listen, the more you worry about your past, the more you lose the happiness in the present. And remember, to heal a wound, you need to stop touching it. Do you know what is the real beauty? Real beauty is not all about having a pretty face like me. It's all about having a pretty heart and a pretty mind. Thank you very much.
Thank you, Afshan Ramzan, for being a nice speaker, and you have finished your presentation within a time. So I would like to request all the speakers to finish their presentation within a time limit of 10 minutes. So our next topic is angiography basic for nursing, which will be present, the Muhammad Javed will be going to present the topic from Punjab Institute of Cardiology. Thank you.